Known as the silent killer in the medical world, non-communicable diseases has in recent decades become a serious health problem in Fiji and around the world. According to the World Health Organization, NCDs have reached epidemic proportions, yet it could be significantly reduced, with millions of lives saved and untold suffering avoided through reduction of risk factors, early detection, and timely treatment. The lifestyle diseases are the leading global cause of death, causing more deaths than all other causes combined, and they strike hardest at the world's low and middle income populations. The WHO Statistic Report 2012 indicates 1 in 3 adults worldwide has raised blood pressure, a condition that causes around half of all deaths from stroke and heart diseases. 1 in 10 adults has diabetes. Of the 57 million global deaths in 2008, 36 million or 63% were due to NCDs, principally cardiovascular diseases, diabetes, cancers, and chronic respiratory diseases. WHO survey conducted in the Pacific region indicate NCDs now account for 3 out of every 4 deaths. Based on this finding, the Pacific Leaders Forum declared the region in NCD crisis in September 2011. 75% of all adult deaths in the Pacific are due to NCDs, with the majority coming from the economically active age bracket, and that many more times these numbers suffer severe side effects that undermine their capacity to contribute further to economic development. In Fiji, 82% of all deaths recorded in the year 2000 were attributed to NCDs. For a small nation like Fiji, these statistics are certainly a cause for alarm, and immediate steps need to be taken to curb the problem.
Did a research last year, national, 2011. We call it the NCD Step Survey. And we've just entered the data, and the results should be, I'm hoping that we get preliminary results this year. Okay. So the numbers I'm quoting are actually 2002 figures, which shows that 16% of our people are people living with diabetes, and 19% live with high blood pressure. Okay. The scenario is pointing towards younger people. I've just come back from Bar today, where the latest casualty, 25-year-old and 27-year-old heart attack. Youngest cases of diabetes and hypertension are also around 25, late 20s. So the scenario is getting younger. So the premature deaths definitely will be moving younger also. At the same time, there's increasing number of children who are obese. So those are 2 dangerous signs for NCD-50.
Dr. Isimeli Tukana, the National Advisor on Non-Communicable Diseases at the Ministry of Health, says amputation is another serious cause for concern.
Nationally, it's about 300 to 400 amputations a year. And before it was more in the Itoke ethnicity, but now it's more or less the same. So 400 amputations a year, that's all amputations, meaning the small digits, 4 foot below knee. So that's the number we're having, 400 a year. Our surgeons are talking about not only increasing in the numbers, but multiple amputation for each case. Like they start off with a digit, and then 4 foot, then below knee, then above knee. So those are the two. It's increasing in numbers also, the number of times for amputation is also increased.
While these may result in economic implications for the family, loss of dignity or hope adds on to the burden. And if not managed properly, it could further develop into emotional stress or deep depression, leading to other health complications and or even death.
I came to Fiji in 2008 when this house was under construction. I came into the door and took off my shoes, and I gone to the other room, and there was a piece of wood where the nail was sticking up. That's how I stepped on it, and I got damage on my very small toenail. And after that, after 1 week, the thing was started to swollen and very painful. I went to the doctor, and the doctor told me it has been tetanus plus diabetic together. And they told me to cut it off. So I have to say yes. There was no more choice because of my life. So they cut it off. They did the first operation right on my ankle. I was staying home about nearly 2 months again. The thing started infected again. And they took me back to the hospital. I told my daughter, I had enough for the lot of pain I had. Don't take me to the hospital. I just had enough. I want to go. And they took me to the hospital by force. They forced me to go. So they cut it off from here. Because I'm an alcoholic too, in my time. I had about 3 operations here, 2 operations here, 5 operations altogether. That's how I feed my leg. When it was both healed, I do exercise. I exercise every day. When I wake up in the morning, I do my exercise. That is pressing up, lying down on my back, kicking up in the air like that, and spreading my leg like that, and do that, and do running like going on a bicycle. That is every morning and every afternoon. I do that every day. That is how I get my fitness. Because this kind of sickness need a fitness in your body. If you just come in and lie yourself down daily, sleeping, doing nothing, you're gonna get worse.
The Foundation for Rural Integrated Enterprises and Development, a development NGO working in the underserved communities, recognized the issue in its early years of establishment. Highly visible burden of NCDs, increase in poverty and dependence on processed foods prompted FRIEND to develop community awareness programs on healthy lifestyles.
People were not eating healthy. There was very small children with skin issues, malnutrition. We've seen a lot of amputees in the communities, people, and we know the national statistics of diabetes and blood pressure is so high. So one of the modules was about changing attitudes on food, and we would workshop with the women on what were they cooking, and we'll show them the food pyramid, what were they eating out of this. And it was quite a realization for a lot of women who were sending their children, giving their children money to buy from school canteens, for example, or just noodles was a common thing that people were eating, children were eating. And there was quite an awareness of, okay, we need to eat healthy. But affordability became an issue. So we have a strong program on backyard garden, a range of backyard garden, growing organic foods, having compost. And one case comes to mind. This woman did analysis and found that a very large proportion was going to kava consumption. And then she took this budget to her house and talked to her husband and talked to her father-in-law and other family members. And she said that, this is part of our governance training program, she shared that they were quite shocked at the amount of money being spent on kava on a regular basis. Because it's $2 a day or $5 a week, you generally don't think. So then the whole family made a commitment. They were going to reduce on the kava, they were going to budget on it. And it was quite a revelation to them and also to us, and it was quite an empowering exercise.
While Friends Community Governance Program was able to promote health to some extent, the organization realized the potential it could have with a specialized medical department conducting clinics in rural and remote areas.
When I first arrived, I wanted to explore Fiji. I knew I was interested in non-communicable diseases. I knew I was interested in chronic diseases, but I wanted to see what was out here and what was happening. After working with various organizations, I realized there wasn't a sustainable non-communicable disease management model in the country. And so for that reason, it became an interest of mine to couple the work that I was doing with another organization that was doing sustainable non-communicable disease management in the country. And that's when I approached Sashi. And she kindly was open to the idea. And the model that I was interested in was one that was based on a mobile clinic, sustainable non-communicable disease model. So basically, we would manage non-communicable diseases with a mobile clinic in the most underserved communities of Fiji. And that's kind of where the motivation came from. As far as why I wanted to work in underserved communities, it's just simple math. There's no shortage in the world, it's just a matter of misdistribution. So as long as we're placing our resources and skills in those contexts where people are underserved, where people are well below the socioeconomic median point, we're in a sense helping restore the natural balance that should have always been there. So that was always my primary motivation from the beginning, and coupling the work with Friend, who was already within the underserved communities, was a great motivation for me. And as we all know, the governance program was doing such great work within the communities, whether it's backyard gardening, composting, health and hygiene, nutrition. They were already doing sustainable development work in the community. So to be able to couple the medical model with that would have provided a very holistic approach towards the management of non-communicable diseases. So all in all, it just seemed like a right fit, and it seemed like the right thing to do.
So when Dr. Animesh Sinha came and shared his brainwave with us that how about, to add to your program, how about screening and as a visiting doctor, he used to come to Fiji often, and he used to say he was quite shocked at the number of people he was screening. He was finding that they did not know, but they were carrying diabetes or they were carrying high levels of blood pressure. And he thought, and he used to lament that there needs to be a larger screening program, but not just screening. People were screening and going. These people needed care. So we started. It was very hard. I mean, we believe that Friend is a house of dreams. We try and make dreams happen, and this dream was a good dream. We wanted to make it happen. We didn't know how. It was a struggle. Being a non-medical NGO, we had to start thinking medical. Meetings with Ministry of Health, meetings with all the relevant stakeholders, hiring nurses, getting medication, following protocols. So it was a huge learning curve for Friend to have a clinical setup, but we realized that it absolutely fit into the model of the organization, and by being able to offer that clinical support to the people, coming from some of the areas we go to are extremely remote. Buses are not accessible when the roads are not so good, when it's flooding, when like non-cane cutting time, people don't have money, villages not having money, not having access. So by being able to take a clinical program to their doorstep, being able to do screening, being able to provide medication, clinically trained registered nurses, having a doctor go into the community, We have a physiotherapist who could work with the people who have had strokes and have been in bed for long periods of time. And then to add to that clinical bit, we have the non-clinicians going in, ensuring that there are gardens, that there are exercise programs going in. So we've been able to offer a very holistic model. So though initially we thought, oh, clinical, how would we do it? But it absolutely has fit into the overall model of the organization to provide integrated holistic health. And it is crucial for poverty alleviation. By just providing economic or just getting people to believe in themselves, it's not enough, especially when the country is faced with a crisis of NCDs.
The partnership between FRIEND and US-based Dr. Anime Sinha led to the formation of the medical program known as PRISM. Dr. Sinha, who was the founder of the program, believed a holistic approach would greatly assist in curbing NCDs in Fiji, as his assessment indicated there was a gap between treatment, prevention, education and awareness about how to deal with this growing problem.
It's often a matter of confusion that when people refer to medical care, they only think of medical care in terms of a clinic or providing medications or performing assessments such as taking blood sugars and blood pressures. But in its original form, in its purest form, medicine includes a great deal of prevention as well, and should include a great deal of prevention. And that's why I think coupling our work with FRIEND was so important, because it wasn't just a matter of working within the communities and just taking blood pressures and blood sugars and going. It was a matter of changing the culture of health, being able to go into the community and impact the way people live. Primary prevention is the key part of NCD management. And with primary prevention, as most of us know, it includes 4 risk factors. That includes, cutting down on excessive use of alcohol, stopping tobacco use, exercise, better nutrition. These are all the major factors that need to be focused on with non-communicable diseases in terms of primary prevention, or prevention before disease has occurred in its most blown up form. So that's why it was very, very important to do this kind of work within a medical model. And this is the way I think a medical model should be geared. And again, a holistic approach is very important, also because you need to have a multidisciplinary team to get this accomplished. We have nutritionists, we've had physiotherapists, we've worked with pharmacists, we work with a broad array of people with broad backgrounds who can help tackle non-communicable diseases in every possible way. And then to have a great governance team, which is based in kind of motivating the communities to do the right things for their health and creating situations where they can continue to sustain their lives, whether it's through income generation projects or providing them with skills so they can continue to feel positive about their lives. And we all know once we've been impacted on the level of feeling good about our lives and where we're going, that essentially also impacts the way we take care of our health as well. So for many, many reasons, it was important that we address this from a holistic perspective and not just look at a clinic model in terms of just taking care of problems when it's occurred acutely, but looking at it as though we need to prevent the problems before they've occurred.
Each new project comes with its own set of challenges, and the PRISM Health Program was no exception. However, these didn't deter the organization from reaching out to those in need.
It's not easy for the team to be continuously going out into the community, sometimes where it may not be very comfortable, but it is something that the team wants to do. People have made the choice of being able to do this kind of service when they come to us.
When the medical program was started, it was started under FRIEND. And FRIEND had already had a great deal of credibility in Fiji, and they had already done a great deal of groundwork within these communities. But as with anything that you start in the community, a needs assessment needs to be performed. And then once the communities have welcomed us in, then we go forward with the medical work. And that was performed. And luckily, with FRIEND being a presence in Fiji, a strong presence in Fiji, it definitely made things much easier for us. But also with that, there was many new communities we came in, many new areas that FRIEND had not been in before. So there was challenges in many, many ways. And because it's a medical model, it required many other approaches that weren't always there. I mean, for example, going into a community, was not always the easiest thing, because some communities were very fractured, and so you had to deal with the community dynamics. Some communities were in very remote areas, so it wasn't always accessible. Many communities didn't have electricity or running water, which made things very difficult. We had to provide our own supplies to get things done. So it wasn't always the easiest things to function in these communities, but we were somehow able to do it. We had to create parameters that were kind of new, but we always followed WHO guidelines to make sure that we worked okay. We had to figure out how we can maintain a hygiene context to be able to conduct our medical work, because it wasn't always the easiest places to maintain hygiene. We worked in very difficult conditions, broken chairs, broken tables. Some places, communities were so poor that they didn't even have tables or chairs. So we had to bring in our own tables and chairs to be able to conduct the work. So it wasn't always easy, and of course there was many challenges along the way, and we were creating a model that had never been done before. So we were all along just continually debriefing, trying to figure out ways we can fine-tune the program to the point that we felt it was perfect. So we would have our weekly debriefing sessions, we would vent, we would talk about our frustrations as a team, and we would come together and reinvent ways in which we could continue to move forward with the work, feeling good and feeling as though the work was being conducted in the most efficient and the most productive way. And again, we even came into new settings altogether. We started working within a market, which had never been done. We started working within corporate settings, which had never been done. We went to communities, and we would function in any place they gave us, whether it was a front porch, a temple, a church, or a community center. Whatever setting we were allowed to function in, we would. And we would take advantage of the opportunities that we had. You can work with a rural community that's spread out, and then trying to get the rural community to come to one setting is difficult. You could be coming into a community that's too small, and because it's too small, you don't have enough people to see. So then in that case, we had to merge communities to be able to provide enough care to the people. And then we could come into a community that, even though it was large, it didn't have a high enough proportion of people with diabetes or blood pressure for us to continue to manage them. So again, the resources weren't being well utilized. So for us, you can almost look at it as though we were going fishing. We would try to estimate which area had the highest proportion of NCDs, and we would go into the communities using educated guesses to determine who needed our care. And in many cases, we were on target, but in many cases, we were very off. But this was how we developed our methods. We could go in and we could say, well, this community is inaccessible. So because it's inaccessible and they have a higher number of people, there's a high likelihood that they're going to have a high proportion of people with NCDs. So we would estimate using different theorems to try to figure it out. But ultimately, through this process, we figured out which communities needed us and which ones didn't, and we were able to narrow down the communities that were able to utilize our care.
The outreach program works in collaboration with the Ministry of Health, taking health care to the people who would otherwise find it difficult to visit a medical facility.
Its collaboration with NGOs like this is very relevant for us. We have come to realize that health is not the business of Ministry of Health alone. In fact, it's not a product that Ministry of Health can claim. It's everyone's business. So the more players we have, the better it is for us. And that's where I think Friends is coming in, not only dealing with issues about poverty and women's issues and gender issues, but more importantly, contributing to the health at the community level, which where the real investment lies. So yes, Friends' contribution, very relevant. An existing NGO who has extended their services to health delivery, and those kind of collaborations are the ones we really look at.
When our medical team goes, even though it's for NCD awareness, we found in certain areas the team has gone and they've treated 40 children in one village for a particular skin disease. Or they have gone into communities and they found that they are asthmatic patients who didn't know and they were suffering. So it's not that when the doctor and nurses go, they only look at this. They look at a whole range of diseases. There was an extremely acute case of appendicitis who was referred to hospital. Our team works very well with the ministry and ensures that any case found whatever care is needed, it's referred to the hospital immediately. Our team has the phone numbers. We've had meetings with the DMO, with the hospital superintendents. It is very easy for our team to quickly make referrals, call the doctors on duty, the registration clerk, and we are able to work well with them. And that's been a tremendous partnership. Because, I mean, it's obvious the ministry may not have the resources to go village to village to do screening. And we are doing that. We're just fulfilling one part of the equation so that the ministry does not have a big burden in tertiary, because we find that a large amount of budget goes into admissions and things. So if we're able to capture them and look after them, then, you know, it's working as a very good partnership. And we find that sometimes certain people in the community have fear of medication, fear of doctors, fear of hospitals. We are able to work with them, counsel them, because we found people with very high levels of sugar and, say, food sepsis. When we refer them to the hospital, we not only counsel them, we try and support them through it. We've had cases, cardiac cases. We've communities, like one community I'll tell you, where we found but 8 cases in 20s, very extremely high blood pressure, and they were all referred to hospital. But also what happens is, any new cases we find, there's a notification form by the ministry. We fill the notification, and then we ensure that the ministry is notified of all new cases, so their data is up to date. In a community, there may be many stakeholders. There are village health nurses. We are working with them, we support them. It's easy for us to partner with the village health nurse. So the way we'll enter our community, we may go with, after we're doing our scanning, our assessments of our demographic population, we'll work through the protocols, we'll go through the Turangani Koro, we'll find whether there's a village nurse, and we'll work through the nurse, so because they know already the existing patients. And what also happens is, the nurse continuously upgrades her knowledge, being able to work with our team in the communities. I think the best thing has been that our team has been able to build capacity of entire communities. So while it's not only like the budgeting and health and social and economic empowerment training of individuals, but village as a whole, or the clinical health of the entire community improves.
In order for communities to trust the program, consistent delivery of service is crucial. Precious time, patience, knowledge and understanding of the local culture, lifestyles and their limitations on being able to look after one's health is also important.
You know what happens in Fiji is there's a lot of education and awareness programs. We all know what's the right thing to do, and we'll say, yeah, oh, we saw that on television. Yeah, that's it. There's no accountability. But a team coming into your community every 6 weeks and checking, oh, you planted how is it doing, how much of this are you eating, do you have, so on a regular basis, and then you think, oh, somebody's concerned, they're going to come and ask. Then you want to be accountable. We also used to find that when we'll give medication, people would take it, they won't take it. So medicine compliance was an issue. So every time we'll say, okay, bring your package back, we want to see. So now it was really nice, because when they'll come, they'll say, oh, 2 days I forgot to eat it. So there'll be 2 tablets in the plastic bag. That's okay, we know. But there were also times where people would come back for their clinic with the entire packet full of medication. And even recently, I was told that an entire full medications were coming back. So we're spending so much time, and if they're not consuming medication, then we talk to them, we process them. Was it a fear of medication? Are they forgetting? Also, sometimes people say, oh, I took my medication, I feel well now. See, my blood pressure normal, my sugar normal, and they stop taking medication. So us being in the community on a regular basis, we are able to find those people, check, okay, we have the contact details, we're able to check on them and say, you didn't come to clinic, how are you doing today? Or being in the same community, it's easy for us to follow up. And large number of patients are lost in the system like that, because either the bus fare may be an issue, or they may not think it's that important, because blood pressure, diabetes, these sort of things, it's not like a big something, a physical on you that you can see. You say, oh, it's okay, I feel a little dizzy, it's okay. and then that could cause traumatic events in your life. But at that time it doesn't, you don't realize it, the impact. So team in the community on a regular basis, being able to check, okay, what are you eating, how are you doing, how are your children doing, are you all right? And we find that people need to talk, they need to speak about issues. So that's how our team times the community. They know how many people on average will come, how many patients they'll be seeing, how much time they can spend with each one of them. And because there are many team members, so somebody would be doing triage and the nurse would maybe doing the screening. When it's one level of counseling, they go to the doctor, there's another level of counseling, and doctor is able to spend time, what medication, how, and what. They may need physiotherapy. The physiotherapist is able to spend time with them, all in one setup. Nutritionists would be able to spend time with them. So then people get this, the whole one message is re-emphasized a few times.
A nation that traditionally lived off the land to one now that is relying heavily on processed food is seen as the catalyst towards high NCD cases. Abuse of kava, alcohol, smoking, and hard drugs are other common contributing factors.
NCD, why it's relatively easy to manage is because it's a lifestyle. And definitely there's a change in lifestyle, particularly our eating habits and our drinking and breathing and also our physical inactivity. Those are the four big things that have changed. Yeah? We've moved from a population who ate healthy and were more physically active to a current population who are eating a lot of unhealthy foods and drinking a lot of unhealthy drinks and breathing. Now we're up to glue now with our children. We had oxygen, then people moved to marijuana, now they move to hard drugs and then glue. And then people are glued more to their television and video games. So these are things that keeping people from being active. So the lifestyle changes has caused increase in NCDs.
The original Fiji was a land based in laughter. It was a land based in smiles. It was a land based in motivation, energy, and health. It's a land of color, fruits and vegetables readily available. That's the way Fiji was, and that's the way Fiji is intended to be. It's a shame that we've lost touch with those roots, because that's what our ancestors were, and that's what we need to maintain if we want to enter the next phase of Fiji's development. Because right now we're far removed from these origins.
In order to curb the current trend in NCD statistics, the Ministry of Health has taken steps to protect consumers. The National Health Body has placed guidelines for food manufacturers on products that are seen as contributing factors that give rise to NCDs.
That's one of the major areas that the Ministry of Health is working. We have been successful in the sense that we've been able to engage the food processors. What we are saying now that 51% of Fijians are eating from the supermarket, and what we are telling the food processors, that won't change. In fact, it will increase. More and more people will eat from the supermarkets. It's time now to talk to the food processors to make their foods healthier. So what we are saying to the food processors, we don't want to touch your profit margin, that's your business. Our business is to increase the health value of your foods by reducing your salt, your sugar and your fats. So what is actually happening now is we're negotiating with them to come to a consensus where they still get their profit and we get our health benefits so that the people will benefit.
Changing attitudes and breaking old habits isn't easy, so more education and awareness programs are now targeted at the younger generation.
The success in NCD definitely lies in early intervention. Early intervention in the sense that we have to start from the womb as early as possible, because it's a lifestyle disease. Now we cannot change people, we cannot stop people breathing. All we can say is breathe oxygen, rather than tobacco and glue and marijuana. Similarly, we can't stop people from eating. All we're saying is get to your balanced diet, reduce your fat, salt and sugar. Drinking, at the end of the day, drink as much water. Your water intake must be more than your juice, your kava, your alcohol and your fizzy drinks. And move 30 minutes a day. Eh? So that message now the Ministry of Health is moving right down. We want to target the first 18 to 20 years of life. That's where the investment is. If you just change the lifestyle there through legislation or through health promotion and through collaboration with donor agencies and non-government organizations, early intervention meaning starting as early as possible in life, then we have a very good chance of reversing NCD.
Healthy eating habits within schools is very, very important. The unfortunate part about it right now is there's a major emphasis on processed foods, not eating enough fruits and vegetables, not exercising. We see childhood obesity growing in large proportions right now, no pun intended. But we see it happening in great numbers, and it's very, very unfortunate because NCD prevention starts at a very, very early age. And unless we start changing our patterns, it's not going to lower the proportion of NCDs that we're already experiencing. We've worked in schools, and one of the most unfortunate parts about working in schools is I often see schools selling candy, and this is how they raise funds. I mean, we are already a country that has such a big problem with NCDs, and we're doing this at the school level. That's highly unfortunate. Right now, we should be serving fruits and vegetables in the school. We should be focusing on physical education. We should be trying to, get children to understand, even to the extent that they could teach their parents. But we definitely must start at a much earlier age. And great part about Fiji is we have some of the most athletic kids in the world. And if you look at our kids, they're some of the most healthy kids in the world. But what happens after they hit the age of 30, 35, you see men suddenly becoming morbidly obese, not just slightly obese, morbidly obese. And that's because people stop taking care of themselves. They stop being active. So we must maintain the activity level we have. We must eat right. And this has to carry through to even generations beyond children.
We have four targets. The major one is keeping the healthy. I've said there's 16% of diabetes, so we're targeting the 84% who are healthy, keep them healthy. The second target, those who are having problems with smoking, unhealthy diet, alcohol and physical activity, is to improve their life so they can move back to healthy. The third target is our special outpatients. We want to look after our high blood pressure, high blood sugar and high cholesterol well. That's special outpatient. Then the fourth one is specialized services for our doctors. We have now moved to cardiology services. I think kidney services will be coming later, brain and all these specialist services. So there's a 4-tier program of attack, and we are taking all 4 of them, and with the hope that doing those multifaceted and multi-pronged interventions will happen.
Friends Medical Program, being holistic in nature, comprises of a doctor, registered nurses, a physiotherapist and a physical exercise trainer. Its preventative work sees the team conduct clinics in 6 communities per week, with a follow-up scheduled every 6 weeks. Social and economic program field officers also visit the same communities, empowering them through skills training in areas such as backyard gardens, goal setting, income generation and budgeting.
7 years now for coming to Naviango, and they, friend brought a lot of things, especially our life. We don't go to hospital. They come to Naviango Community Center. We talk with them, with what disease we bring to them. They give the tablets, they give the capsules. In this community, friends do a lot to us, especially life in the village, the surroundings and the backyard gardens, and how to help each other. So all these we learn from friends, and friends taught us all these things till today. We eat what we plant in our backyard garden, and we sell. Even myself, I sell bhaji, I sell roro, I sell bele, I earn money from there. Yeah, and we eat a lot from our backyard garden, and no sickness come to us. People save money too. Some people, they save $10 a week, $5, $3 a day, what they sell, eh?
The communities that friend works in are identified based on their need, social status, and accessibility to services such as transport or medical.
In a Fijian setting, before we go to the village, we usually approach the Turangani Koro, taking our sevu sevu and seeking the blessings of the village, even though they are aware that we're coming to the community to conduct health screening. We realize that it's always good to develop a good rapport with the villagers and the other members of the nearby communities before we started our health assessment and screening. And with the other communities, we work with the advisory counselors and the head teachers of nearby schools. Our approach is the treatment is to be holistic. So we look from the spiritual, mental and physical aspects when we carry out our medical care. So it is important that while giving medications, it's also important that patients are aware that it's not only medication that will help them, it's also the incorporating good dietary habits, so which means that they need to have a good backyard, also exercise. So we have a nutritionist and a physical activity officer with us that goes out with a team to the communities and help the patients and the community members that need advice on the issues of preventing of diabetes, blood pressure and cardiac patient. So as a whole, we are trying to focus on preventative measures. We screen those 18 years and above, and we screen the whole village or communities, and from there we identify those that needs treatment. We put them in the charts, and we have an ongoing program, 6 weekly visits to the community, and we've noted that the response is pretty good.
The clinic is held at a central location within the particular community to enable easy access for all residents. The setting may differ in each community. It could be hosted by a community member at his or her home, a school, a place of worship, or a community center.
Yeah, I have a lot of benefits from here, because when I come for clinic, I check my pressures and the diabetes been checked. They give me the pills and my diet. They giving me the diet, what to use in diet. So I'm using on the diet. So is my weight come down and my pressure and diabetes is normal now. Before was very high, about 28, 25. Before I used not to come to these people. So when I come for this clinic, so my diabetes come down. Because I was eating everything. Now I'm just eating by the diet. Not having a lot of meats, having fish, boiled fish, food all, no more the oil and curry powder food, that's why it's come down. And even the brown, we have roti brown, we are Indian, we need to have roti. So we have brown rotis. You know, the brown sharp and the boiled rice. Before I was using normal rice and normal sharp. That's why the sugar was gone now. I got everything. Whatever these people told me to plant and use, I'm using the same thing. I'm using what you call the mother and the cabbage and the lettuce and one thing another. What's it? Telling me to plant the sarso. Sarso. I plant sarso, I'm using sarso. Sarso is good for the heart. They told me, you'll clean the heart. I'm doing all that thing. I got a lot of things there. But they stopped me only to don't have cassava. I got plenty cassava but can't eat. Once in a month I can eat a little bit, but not much. Very good benefit with the committee. Very good. Everybody coming now. Before you used to come only 5 or 4. Since when they transfer from Vitongo to here, so we now 25, 30 start coming in. We save money, so go to town, go to hospital, come back, waste our time down there. So we saving money. So here we just come walk down here. It's very short time. Just come and we go walk down. So we save a couple of dollars there, about $3, $5.
I used to visit private doctors before when I was sick, and it cost a lot. But since Friends started its medical outreach program here, it's been convenient for us. During my initial checkup, I was informed that my blood sugar and pressure level was very high. But I was able to reduce this based on the instructions given by the medical team. Since then, all is normal and I haven't missed a checkup until now. I have been advised to eat healthy meals and exercise on a regular basis. It's important to heed the advice. I don't take sugar now and reduce my meat intake. Most of my food is boiled. But I must admit, it's not easy. Today, I was told that I gained 2 kilos since my last checkup. I remember eating rice and didn't exercise because I was having problems with one of my knees due to the cold weather. But I have promised myself to be strict and follow the advice given to me. This free medical clinic operated by Friend has lots of benefits. I'm able to get regular checkup. At the moment, my pressure is normal. I'm also able to know my blood sugar level, and I'm very happy. Before this clinic began, I faced lots of difficulties if I needed medical treatment. It costs a lot of money to go into town to see either a private doctor or to the hospital. But since the Friend Medical Program comes to our doorstep, we are able to save on cost as well as time. We also are given free medication, so that's a plus as well. I always look forward to the Friend Medical Clinic. Friend's medical program is convenient. It allows us time to complete our household chores before visiting the team. The clinics are close to our homes, so we can just take a walk. There's no need for transportation. We are able to spend enough time with the medical officers, and there's no need to wait long hours to get examined. When we are healthy, we can do all the housework and visit our friends and family. But if we are sick, you cannot do anything. So it's better to follow the advice given by the medical team and stay healthy. Attending the clinics also enables me to meet my friends living in the community, and we are able to catch up on what's happening around us. We get good advice from the medical team and what fruits and vegetables to eat, and more importantly, how it should be prepared.
Being in their own community setting and well acquainted with the medical team builds trust and confidence of patients who are able to share their problems openly and follow the instructions provided after examination.
So many people don't trust the medical system. They've either lost somebody in the hospital or they've had to deal with long lines and short appointments where they felt the doctors or the nurses didn't care. But for us to be able to go into community to establish a relationship with them, we became part of the family. And we, in a sense, were able to provide them the education they needed so they could feel empowered. Instead of 2-minute visits, we were offering 20-minute FaceTime with each patient. We were helping them in their gardens. We were getting to know their families. They were saving money because they didn't have to pay a bus fare.
More than anything, relationship is important, because we do find people who are a little scared or a little nervous about going to a structure of hospital where there's a fear of needles or fear of, oh, what's if something's found. And here, because the trust is there, the nurses and the same doctors keep going again and again. Because of the trust factor, I think we are able to not only screen, but keep a large number of people coming back again and again. And hopefully we're supporting them for a period of time. Those who are not found, hopefully we can do continuous prevention. Some who we find with lesser numbers, we're able to continue to monitor them. And those who have been screened and found, sometimes for the first time, they're offered counseling, they're offered support.
I would like to thank FRIEND for bringing the medical program to our community 2 years ago. This program has brought a big change in the mindset of people in our settlement. We faced a lot of problems when someone gets sick and needs to be taken to the hospital. But since the health program started here, we have seen an improvement in the health of the people. The medical team conducts checks and the visiting doctor prescribes necessary medicine. Many people who are sick get treated by the team. They also educate the people on what foods to eat and how it should be prepared. We have also changed our diets. We are eating more freshly grown fruits and vegetables and less processed food or fatty meat. We have also decreased our oil intake and use of white flour and rice. We have stopped buying tea from the supermarket. Instead, we are using lemongrass, rosella, or lemon leaves. If someone gets sick, we have to hire a carrier which costs $10 each way, not including the waiting charge. But since the medical team have been conducting regular checks, visits to the hospital has been reduced. For those people that need further checkups or treatment are referred to the hospital by the medical team.
The village elders have acknowledged the relevance of the various programs offered by FRIEND towards social and economic upliftment of the communities. Their blessings have won the confidence of the people as they embrace and benefit from the services provided.
I myself am asthmatic. I have always used asthmatic inhaler to help with my breathing, but for some time now, I haven't been using it. Working on the plantation has helped me exercise and eased my asthma problem. I have an asthma pump, but keep it at home. Everyone in the village has been active in their gardens. Even the ladies are doing their exercise, taking yoga exercise with a FRIEND instructor and going for daily walks. We are eating a lot of green fruits and vegetables. Through our partnership with FRIEND, we have also been given seeds which have been planted in our gardens. This has enabled us all to eat healthy. Even our children take fresh food to school daily. We are able to save money on marketing, and when we have surplus vegetables, we sell it by the roadside.
It took us by surprise because we never knew what it was all about. But then after several visits, people became aware, the villages, and we are thankful for this particular NGO friends for caring about us and our health, coming to visit us every month. And as you know, We have difficulties in the village because most of these villages are just living day by day without, unemployed, just living on as cane cutters, farmers, and fishermen. So health is the least of their priorities. To be honest, before Friends, we never had a program for women. But since their visit, we have made it we have put targets every month on what to do. Because we know that when when the team come, they would want to see what we have been doing. So one thing they encourage is for us to have our gardens and what to plant. They bring seedlings, and they encourage us to do more. We uproot, and then after that we replant, and that is something good with us. But before that, we never used to have those kind of programs. So we are thankful to them for that, for awareness. We've seen changes, especially the attitude of the community members. They've realized that health is most important, and they look forward for monthly visits. Since we know that we have our folders with the team, and that means that we have some sort of problems, medical problems, like they target NCDs. We have people with high blood pressure, diabetes, and with our weight, obese, overweight, and since the service started in Vitong, we've realized that we need to move away from this overeating, eating unhealthy foods, and through their advice, we've realized that we have fresh vegetables, which should be our daily diet. So they've helped us with our backyard gardens, which every household has until now, and it is something that we look forward to do our planting, see how our neighbors are coping with theirs, and we compare our programs. And one thing that I've noticed, that we have less ambulance calls coming to the village, since everybody is aware of what they should be doing up until now, and they've been on medication. And we've always talked about going to hospital, but then we fear the long queues there at the hospital, and some do not have fares to take them there. And we are so glad that friends come and visit. One thing funny, we have so much land, but we think that land is for sugarcane only, and tapioca and things like that. But now, as you can, if you go around the village, you'll see cabbage and tomatoes and beans and bora and things like that. And of course, we are saving from our weekly shopping from the market. Instead of going to the market, most of us pick from our gardens.
The community clinic has also detected patients with complications that could have proven fatal if it had not been given necessary care, counseling, and on-time referral.
I'd like to relay the story about my husband. We come to the village hall to do our checkup, and on that checkup we found pulse was very low at 40 that day, and we didn't know what that meant. But she was telling us, I advise you to go to hospital and make another check, because this is not normal. It is very low, and you can be finding difficulties with your walking and breathing and things like that. So it was during that time that we were also organizing for our International Women's Meet, which was to be 2 days after that. And we know that we were quite busy and he wasn't having enough rest, so we took time to go to the hospital. That day, made a few calls to the A&E staff, the doctors, and we were grateful because when we arrived, they were ready to see Rat. And upon several checks and his tests, he was diagnosed for complete heart block. And then the doctors were explaining what that meant. And we knew that he had diabetes, a bit of diabetes and high blood pressure, but we didn't know that he had some heart problem, cardiac. So when he was admitted, we got the story from the doctors. And when he was diagnosed with complete heart block, I realized that my effort was not enough, and that our sickness is not just an overnight thing. It was a lifestyle. It should be a lifestyle, something from the past. And I agree that he has been taking, we were taking full cream for almost all our lives. And we have about 3 packets of full cream milk a week. And that's in my budget, not including the Rewa Life for our porridge every morning. And I was at one point feeling bad because I should have been an example to my women members, because I do most of the talking during our meets. But then, on the other hand, I was glad that, because without friends, we wouldn't have known. Because he was driving around that day, we were doing all this organizing without us realizing that his pulse was really that low. But now I'm glad that he's completed his surgery for the pacemaker insertion through the doctor's advice. And he's recovering well, and we are looking forward to continuing our checkups with friends to monitor how he is going to be for the next few years. About a year ago, we started this program with exercises with Maria and Leite, and we look forward to these exercises because they teach us a lot of things. They've been telling us that that through exercises, just indoor ones, we can get rid of some of our pains and aches that we used to have. And on this program too, they do house visitations for those who are confined to wheelchairs and some paralyzed. And we've seen that they've improved a lot. They will. We've talked about it in our meets and during discussions with our fellow villagers that these 2 ladies have been doing an amazing job with us.
One. Two. 3. 4.
I didn't have any form of movement prior to the exercise program conducted by physiotherapist Maria. My family members used to place me on a large piece of cloth and drag me across the floor to the bathroom. I couldn't move my hands and legs, and this became a normal routine. I used to just lie on the floor and look up. I was feeling helpless and depressed. But when I started to exercise under Maria's guidance, Slowly things began to change. I could notice slight movement in my hands and feet. The exercise wasn't easy, it was painful. There were a lot of tears, but I knew I had to try. I was encouraged and I continued to work hard, and slowly things changed. I exercise every morning and afternoon for about 30 minutes. I feel refreshed after that. I also sit in the sun. It feels good to feel the warmth from the sun and just breathe fresh air.
Just simple exercise, moving his legs, moving his hands, exercise his stomach, turning and twisting. We found it really hard at first. But as they say, no pain, no gain.
Yeah. I never thought I will be able to move my limbs. I have been bedridden for the past 14 years. I never thought that one day I will be able to move again. I had always dreamt of it, but when I tried, I couldn't, and I got disappointed. But now things are looking better, and I am hopeful that I will be able to walk again. I feel stronger inside me. I can sit up and talk for long. I can now use my walker and move around the house on my knees. I'm also able to breathe properly. Before, I couldn't do any of these things.
You don't have to be worried. You have to be happy all the time. Happy with your friends, happy with your brothers and sisters. You have to joke a lot. You have to make yourself happy all the time. Do not be looking ugly and disgraceful. When somebody comes and sees you like this, you are like somebody dead. Your face and everything are like that, looking at them. No, you have to be happy all the time. Happy is the main thing. And part of that, apart from your diet, you have to do something good to your body and your soul. Lotu lotu. Lotu lotu all the time and play music. If you can play music, play music. If you don't have the variety to do, just sit down on where you are sitting and sing all by yourself. Make yourself happy all the time. Some people in Fiji, when they've been given medication, a tablet, they don't use it. when the doctor gives you if 12 tablets or 30 tablets, take it through the doctor's advice. If you don't take it, it's your problem. You can go to heaven with that, taking tablet. If you feel good, you take 1, 2, 3 tablets, Fijian style. You pick the rest of the tablet, leave it aside. No, don't do that. You have to finish all the tablet that the doctor wants you to have. Don't keep the rest when you get fit and throw it away. That's not the idea. Most people in Fiji, I know, they've been killed. They died just unexpectedly because of that. They don't take the medication in the right time. And what the doctor tells them what to do, do it. If the doctor tells you exercise your body, exercise. If the doctor tells you not to take sugar, don't. The sugar will stay there and you will go. If I have been going without sugar for 3 years now, no sugar, no cake, nothing with sugar. You eat. If they tell you not to take sweet things, don't.
Tabu mate, jangan na mabuang laylay, o tungay vale, o tungay pidanam madaw, sanggala ko banimbula.
There has been a dramatic change in my life since losing my leg due to diabetes, but this prosthetic limb has really boosted my morale. People in the village know that I am an amputee and expect me to be dependent on others. I used to walk around with a stick before and it was really a struggle. But now things have changed. I do my own planting and live independently with my family. I am able to do all the things I used to prior to the amputation.
It has really changed our life. At first, we didn't know what to do when he lost his leg. But since getting the prosthetic limb, it has changed our life. We are able to continue our lives as normal. He is able to move around easily and do all the work. We are all happy for him.
We can prevent 80% of our NCD if we start educating our children right from pregnancy upwards. We have a good chance of the messages are simple: breathe oxygen, eat a balanced diet, drink lots of water, and do a lot of physical activity, rest well, think well. Those are the simple messages we are doing. And at the same time, for them to, if they live that healthy life, then the chances of them living a long life and healthy life is more. So the message is we need to create a new generation. It's hard to change behavior, but it's very easy to create behavior. And the aim of the ministry is to create behavior as early as possible, knowing for the fact that all our behaviors are created from childhood. So recreating our wellness behavior, our healthy behavior is what we should do.
For Dr. Asina, who started the medical program and worked in a volunteer capacity, the passion to serve the people has always been the driving force.
Compensation can come in many forms, but to be a part of something where you felt you were making a difference, and to be a part of something where you felt like part of the family, and to be a part of something in a great organization like Friend, where you went out with your family to help your greater family. It's something that you can never ever forget, and it's something that one will always feel blessed to have been a part of. So for me, that was my compensation, which is more earnings than I could have ever made functioning in the Western world with a nice car or a nice house or savings. But for me, it was a matter of just being somewhere in a land that I love, with people that I love, offering care in a way that felt unconditional and that felt ideal. I mean, I can practice medicine, but the pure art of medicine has been lost in the bureaucracy of the Western world. But to be able to practice the pure art of medicine on a preventive level within Fiji is a lost art, number one, and it's a great opportunity. So for me to be able to function that way in Fiji was amazing, still is amazing. When we think about the PRISM medical program, the big picture of what I'd like to see is an expansion of the program, both into the north and its continuing strong presence in the west. At this point, we've got a very strong presence in the Western Division, but I think next up is definitely the Northern Division. These are the two most underserved of Fiji. Beyond that, potentially, once these two regions have been well stocked and everything is moving forward nicely, I think the next step after that would be the Outer Islands. Again, that's a long ways away, but that's a great potential for us. And I'd like to see us kind of expand within different contexts. Thus far, we've worked within the regular communities. We've also worked within the corporate setting. We've worked within the markets. But I think once we enter Lambasa, we'll be focused a lot on the farming communities as well. So I'd like to see it going in many, many different directions. And there's a lot of potential where it could go. We humbly come forward with our model, knowing that people are going to appreciate it. But again, we want to make it clear that it's nothing out of the ordinary. It's just placing a lot of key elements of NCD management under one umbrella, and anyone is capable of doing it if they're willing and motivated to put in the work and find the correct people. Because it's also a matter of finding compassionate souls to go forward with the work. It's easy to say this model works, but if you have people who aren't motivated about creating change within the communities, it's not going to make a difference. When you have the right nurses, when you have the right team, when you have the right people who care about the communities, it's reflected in their attitude, and it's reflected in the way they impact the communities. So it's just very important to find the right people.
Without a doubt, fighting NCDs is a mammoth task, but one that can be achieved through a joint effort that requires active participation, commitment at different levels, change in attitude for many, and getting out of their comfort zones. Friend, through its various programs, built on a foundation of adopting a holistic and sustainable approach, though maybe a small piece in the puzzle, is determined to take on the challenge and build a healthier nation.
One family, and in many cases a breadwinner or mother or anybody in the household, loses a toe or loses a foot or loses below knee, it is very unempowering for the person concerned. The feeling of helplessness, and then the rest of the members, it gets quite hard. Medication, care. So we are hoping that Friend is able to contribute, and that we are very much hopeful that we are contributing to the national health by having this program. by ensuring that less and less people lose their limbs, less and less people have to go to all the way to secondary tertiary care in hospital. We're hoping that more and more people begin to realize and change their attitudes to improve their health. And individual health means a family health is intact, means a community health is intact. So a nation, like the whole of nation. So I'm very hopeful that the work that Friend is doing, we hope that we're contributing to the national health, and we hope that we'll be getting the support from the continuous support from the national health stakeholders.
Lifestyle diseases, you can prevent it. Lack of exercise and unhealthy eating, and diabetes, high blood pressure, heart attack and depression, disabilities, amputation, stroke, smoking and binge drinking. It will kill you. Family issues, lack of knowledge brings you negative thinking. Lifestyle diseases, you can prevent it. Together you and I, we can beat it. Lifestyle diseases, you can prevent it. Together you and I, we can beat it. Drink a lot of water, not yangona. Kana mandanga modeva kavinaka. Exercise taka, racing ataka. Regular checkups, mokuwa ni the lata. Grow your own garden, avoid all tin foods. Tumar garden mess up the way head. Lifestyle diseases, you can prevent it. Together you and I, we can beat it. Lifestyle diseases, you can prevent it. Together you and I, we